Well, I appreciate y'all all coming back and coming by. Sorry we had to switch some things around. Had a bunch of people over at the mansion I had to meet with and everything, and so I appreciate you bearing with us. But I guess the long and the short of it is, and we've got people here that are going to brief you a little bit better than I really appreciate, Dr. Clay Marsh and his team coming because, of course, Clay and I are great friends, and I just think the world of him. He's a superstar, and we're blessed to have him. But nevertheless, the bottom line of what we're doing here is just this. We know we have a drug epidemic. We know that it is cannibalizing West Virginia as well as our entire nation. We're not unique. We're kind of leading the nation in areas that we surely don't want to lead. And we want to lead in a way that shows the nation how we can have a project, a model project, and maybe model that then across all counties, across our entire state, and truly make a real difference. And maybe we are just on the cusp of being able to set a national model and be able to show the world how we can handle and deal with this terrible, terrible, terrible epidemic that just affects all of our lives. Rich, poor, black, white, union, non-union, Republican, Democrat, it gets us all. Some way, somehow, it gets all of us. And so we have started down the pathway in Wyoming County, and I'm going to I think it's, I know Bill Crouch can talk a whole lot about this, but oh goodness, I'm so terrible on names. Help me on names there, guys. But no, I wasn't thinking about Bob. I was thinking about something else. Never mind. I was thinking about someone that had done some of the work, but I don't see him here, but had done some of the work down in Wyoming County. One of the persons is, Senator Klein, and she's helped, tremendously down there, but, it just escapes me. I'm terrible on names, but it wasn't Bob or Bill. But nevertheless, I know Bill Crouch and Bob Hanson can talk to you more about what we're doing and where we stand in Wyoming County. We picked the southern county and we picked the northern county. The southern county is working more in conjunction, I guess, with Marshall University. And the northern county, no question, is going to work with WVU. And the northern counties, the hot spot is Jefferson and Berkeley County. And so what we're doing is we have started down the pathway in Wyoming County, but today we're announcing the same level of pilot project in Berkeley and Jefferson County and trying to really make a significant difference in those areas and then be able maybe to just parlay that or franchise that or whatever you want to call it statewide. So the net of the whole thing just goes back to the same thing I've said over and over. You got a real problem. And there's all kinds of scientific approaches and just hands-on approaches and everything else. But at the end of the day, we know we have to have more treatment facilities. We know we have to have additional training. And to where we can, when you come out of this problem, you can genuinely seek some level of training to where you can go get a job if you're not trained. Now, some people are highly trained and everything. And then they can maybe escape this terrible situation and go on with their lives in a real productive way. And then the third part of the leg always has got to be just this, is sometimes people have brought to themselves some level of record, whether it be misdemeanor or sometimes even felonies that are nonviolent. What we've done with Jim's Dream is developed the three legs of a four-legged stool and look for expungement from that misdemeanor. And that gives people another level of hope. But the last part of the whole thing is, and this is the last and the fourth leg, and there'll be more, but the fourth leg of the whole thing, the way I see it, is we have a workforce in West Virginia that's starving to death too. You know, we have companies that want to come, but really at the end of the day, we can't provide the workforce today. You know, now, there are people, no question, that are migrating back to West Virginia because all the good stuff that's going on in West Virginia, and that's great. But we have got to train and have a qualified, trained, skilled workforce. We have to. We have to. You know, now, from the standpoint of just, you know, initiating growth and all the goodness that comes with it. So to do that, you got to train people and give them hope. But not only do you have to train them, but you genuinely have to train them. You can't teach a person, and the easiest way I can say it, you can't teach a person to drive a pickup and then expect him to go be able to get in a truck that's as big as this room and be able to handle it, not kill himself or kill somebody. So at the end of the day, you have got to have tools to be able to train and qualified people to be able to train. And all that goes together very harmoniously to make really what we need to set out on this mission to do. Drugs not only hurt us in many, many ways, but they're expensive too. They cost us hundreds and hundreds of millions of dollars every year. And so at the end of the day, that's what we're trying to do. Now, the other thing is just this, and think about the concept behind this, and then I'll quit. The concept is this. If you only have so many dollars, you're still trying to take care of the whole state, but you've only got so many dollars. And so if you've only got so many dollars, to me, instead of doing a constant scattergun approach to everything and just hoping that it works, why not glean off some dollars, and do pilot projects on both ends of the state with our universities, with the goodness of these great people and all the stuff they're doing, and glean off those dollars and try to perfect something. So that's the thought process. That's all I know. Now, if y'all choose to ask, y'all ask, and I'm going to probably defer to the experts here. But today, we're very proudly announcing Jefferson and Berkeley County and WVU and all these great people, and they're going to make a difference. That's all there is to it. Yes, sir.
Governor, I was at a press conference February 5th, 2018, when there was a discussion of pinpointing a couple of counties in the state.
Right.
And really trying to fight the drug epidemic in those couple of counties. Is this announcement today a continuation of that thought? And has there been progress in planning in the meantime?
Well, I mean, Bill, you probably, but let me just, I'm sorry?
Commissioner Crouch is saying yes.
Well, he is, but I would say yes too. You know, we started down that path with the first county being Wyoming County, you know, and we kind of designated them right off the get-go. And we didn't really have the other designee lined up, and that's what this is. This is just the announcement of the other designee. We wanted one with WVU and one with Marshall and go that way and everything. And so we started down the path with trying to get Wyoming County up and going, and now, Bill, you can take it from there. Bob, somebody.
This is a continuation of last year's effort. We knew we had a lot of federal money coming in at the time, and we were getting through the budget process last legislative session, so we held off a little bit to see how we could get Wyoming organized and get Bob on board and get a little more structured before we announced the second pilot. But this is the second pilot that we spoke of last year, a year ago. And this was the governor's idea. James Green was the governor's idea. We're trying to tie all these things together to try to really move in the right direction here.
Are there results to report on Wyoming County already, or is it still
Uh,
formative stage?
Yeah, it's still formative, but
Bob, you want to speak to Wyoming? Bob actually started working in Wyoming County before we named him as the director of the Office of Drug Control Policy. He and I had a couple of discussions, and he actually asked if he could help, and so he's been working in Wyoming County now for several months. We have a consortium down there. Bob, you want to bring him up to speed on Wyoming?
I was just in Wyoming County on Wednesday working with a community group. There were 25 people present. Their plan is 99.9% finalized, and they are implementing initial projects. They are very close to implementing a quick response team within, I'd say within the end of, certainly by the end of March. So the plan is almost finalized, there's a little bit more left, and there's a great group of people, multiple agencies and people from the community that have been continuing to work to finalize that plan. I'm very excited and encouraged about what's going to happen in Wyoming County.
We will say Clay Marsh is here, Jefferson. We have some folks from WU who can speak to this project. We have folks who are going to be involved in that. We'd like to hear a little bit about the Jefferson and Berkeley County project.
Clay, why don't you introduce, again?
Yeah, sure. Well, I want to thank the governor and Secretary Crouch for their unending goal to make West Virginia not only a great place to be, but a very healthy place to be. And Director Hansen, who's doing a wonderful job with the Office of Drug Control Policy. So I'm really very, very proud to represent our great team from the eastern part of our state, Jefferson, Berkeley County. So Dr. Emma Eggleston, and Emma, why don't you come up and introduce the rest of the team, and then we're happy to give you guys just a quick frame on what we hope to do. Please.
Yeah, sure. So hi, I'm Emma Eggleston, I'm the Dean of the Eastern Campus. And the team that came with us today, we have our Berkeley County lead, which is Angie Gray, and she is the nurse director of our local health department. And then we have Giselle Perry, who's helping us head up one of the behavioral health components for families and women, because Giselle does a lot of work with our maternal addiction programs in our area. And then Nathan Fury is project coordinator who works with a lot of our community partners who have helped us with all of us. And this project is really, will mainly be implemented by our community partners. And Nathan will help us coordinate all of that.
And if I could just add really quickly, one of the goals that we've had from the very beginning of when the governor and Secretary Crouch started to talk to us was how do we start to rebuild families, help children, reduce adverse childhood experiences which are associated with lots of early traumas, with diseases, with risk of overdose and suicide. So this program is really about starting to focus all of the community resources, knit them together, bring those resources to people in need, and particularly focus on pregnant moms and children and families and community. So it's really, I think it's a great program not only on the opioid side, but this to me gets at the root problem of chronic illness and chronic disease. So I feel very proud and I'm very optimistic that when we all meet together again, we'll have some really exciting results to report back to you, Governor, Secretary Crouch, and Director Hansen.
Let me just say this. And I wish we had 400 people here. I really do, because I wish to goodness that they could hear. I wish we had 400,000 or 4 million, because I'd love them to hear me just say just these words. We've got the expertise right here to be able to fix it. We've got the expertise. Now, unfortunately, this is a problem that's going to take a lot of money. It's just going to take a lot of money. And so we've got the expertise that's going to try to put us on a pathway with pilot projects that will put us on a pathway to give us a formula to fix it, Now, and the formula can be lots and lots of different directions. But the other thing is just this. Be me just a minute. Be me and say, okay, today we've got more jobs in the state, and we've got people that can fill the jobs. Today, we're actually building roads and trying to fix a road so you can go to the convenience store. And today, we're making a real life commitment to education in our state, and we've done the same thing with our veterans. And like it or not like it, today, the numbers and the monies that are coming into our state are pretty daggum good. There's one other thing. There's one other thing that's absolutely holding us back in every way. And that's what we're here to do right now. And that's this drug situation that's absolutely difficult to drag. Now, be me. I came in and really and truly what we had to do was we had to get jobs, and we had to get roads, and we had to get education, and we had to get our vets, and we had to get our economy moving in the right way where we have dollars. But we still got to get this. And this is really, really important. And I'll end by just saying this. This man told me so many months ago, or years ago now, that it's all about the quality of life. It's all about the community and the quality of life. You know, that's what we want to really change. That's what we want to do. We want to make the fabric of our communities better. It even goes back to tearing down all these old structures and everything that are just there and just eating at us. We want to do just what he said 2 years ago. This is a superstar. He said, we want to make our communities better. And maybe I'm not saying it near as well as you say it.
You said it perfectly.
But that's just it. And so that's been the mission. That's been the strategy. You had to have the jobs. You had to have the roads. You had to make a commitment to education in our veterans. You had to get the economy right. But we've got to get this right here too. And part of getting this right, believe it or not, is tearing down all those old junk places. You know. So I can't thank all of y'all enough. We're really doing it. And it's going to be good. If we don't get in our own way.
Is this technically part of Jim's dream, or is it a separate dream? Separate related dream?
Well, it's surely technically a part, but it came about really and truly before Jim's dream. You know, so I mean, it's the franchising part of Jim's dream. You know, but truly, Jim's dream takes it to another level as well. So, but it all ties in together, and it ties in just this way. It ties in. We got to some way get this drug thing under control, and we got to some way get our people back, and we got to some way train the workforce. Then all kinds of great stuff happens. That's it. Thank you again for waiting around on me. I'm leaving. Going the other way again. Okay. Bob, thank you, sir.
Sure.
Okay.
Can we get a picture with everybody?
Oh, I love you. I love you.
Come on, Bill.
Don't make me look good.
Bill, come in.
Thank y'all.
You know Bill Ramsey too.
Let's get around this somewhere. I'll stand here in the middle.
Good.
Okay? Y'all make it look good now. Okay, now. All right. Yeah.
Thank you.
Okay.
Appreciate it.
And can we also get one?